Hello guys, welcome back to my channel. Today we're going to study some pharmacology. Let's get started. Today's drug group is ACE inhibitors, or angiotensin converting enzyme inhibitors. These drugs are used primarily for the treatment of high blood pressure and heart failure. Generally speaking, they cause relaxation of blood vessels as well as a decrease in blood volume that leads to lower blood pressure and decreased oxygen demand from the heart. This group includes drugs that end in pril, such as CAPTOPRIL, ENALAPRIL, LISINOPRIL, PERINDOPRIL, and RAMIPRIL. The main mechanism is already in the group's name. They inhibit angiotensin converting enzyme, which is responsible for the hydrolyzation of angiotensin 1 into angiotensin 2. The decrease in the amount of angiotensin 2 in the body lead to the following effects: a decrease in vasoconstriction that causes a decrease in blood pressure, a decrease in the secretion of aldosterone that causes a decrease in reabsorption of sodium and water, and eventually a decrease in blood pressure. Dilation of efferent arterioles that leads to an increase in renal plasma flow and eventually a decrease in the filtration fraction, and a decrease in the breakdown of bradykinin that leads to an increase in the production of arachidonic acid metabolites that leads to an increase of vasodilation and eventually a decrease in blood pressure. The most distinctive adverse effect of ACE inhibitors is a persistent dry cough because of an increase in bradykinin concentration. This can be very uncomfortable for the patient, so it should be discontinued. Angioedema, hyperkalemia, first trimester malformations, second trimester reduced renal perfusion, oligohydramnios, hypotension, and even fetal death, dysgeusia, and through an unknown mechanism, pemphigus vulgaris. There are absolute contraindications and relative contraindications. Absolute contraindications includes hypersensitivity, C1 esterase inhibitor deficiency because it predisposes the patient to angioedema, pregnancy because of the adverse effects on the fetus, and breastfeeding. Relative contraindications include aortic stenosis, renal dysfunction, and bilateral renal artery stenosis or a solitary kidney. That's all for today on ACE inhibitors. Feel free to share your knowledge about the subject in the comments below or ask any questions you may have. Thank you for joining me. Don't forget to like and subscribe, and I'll see you in the next video.